Oh, and we have Chad and Tom in the same room. I mean, the same row. Good to see you. We'll give folks a minute to join. We are recording this morning. So hello if you are watching the recording. Give it maybe 30 more seconds. It's good to see folks on this Wednesday that feels like a Friday, I guess, for this week. Okay, so Brian, Chad, and Ellie, we're so excited to have you here from the Rennie Center, and to hear more about the report that you released. Many of us were at the Boston Foundation event. I think it was October. So that was great to see everyone there, and we're so happy you could join us today. As you know, it's a statewide call, so we have folks from across Massachusetts. And the first question is for each of you to tell us a little bit about you and how you came to be in your current role. And I will defer to you about what order you want to go in.
All right, thanks, Amy. Hi, everyone. Ellie and Brian asked if I would go first. I think so. I would talk a little bit and then get out of the way. So happy to do that. Hi, everyone. I'm Chad Dontremont. I'm the executive director at the Rennie Center. In terms of how I ended up at Rennie, where I've been for now 12 years, so it's hard to remember, navigating wanting to have research used to inform effective practice, but being in a position where it really actually made an impact on the daily work that people in the field were doing. So if you go back far enough, about 15 years, I was actually at Strategies for Children as the research and policy director with Amy as well as with Tom, actually. And I've also spent time in the classroom teaching and running a research center at Columbia University and technically working for the Department of Early Education and Care during the Race to the Top era. Running itself, real quick, is an independent, nonpartisan, nonprofit organization. Our mission is to ensure that educational decision making is based on deep evidence and knowledge of best practice. And the report we put out looking at the financial landscape of early education and care is a great example of that because we hope it will be used to better inform decision making across the state. So, with that, let me hand things off to Ellie.
Like Jen.
Hi, everyone. Good morning. My name is Elle Jansen. I am the Chief of Staff at the Rennie Center. I've been with the center for 5 years now. Prior to that, I was a public school teacher in San Francisco, teaching performing arts, as well as an early childhood educator, doing performing arts as well. So I am really happy to be back on the 9:30 call. It's been a little bit of time, and excited to be here today to talk a bit about the report. I'll pass to Brian.
Hello, everyone. Good morning. My name is Brian McGahie. I'm a senior associate at the Rennie Center working on our research team. Please excuse my raspy voice today. I'm just getting over a cold. It is that time of year. I've been at Rennie for about 2 years now and previously worked in the Massachusetts House of Reps for about 6 years. So kind of come the policy route and decided to specialize in education. And really the reason for that is largely because of the teachers that I had growing up that really just showed me the impact of a good teacher on kind of encouraging a student's curiosity and confidence. And I really try to carry that into the work with me. So excited to be here today.
Great. Well, you should be able to share your screen, and we're excited to hear the update.
Okay, let me do that.
This is the hardest part of the 9:30 call, Brian, getting the screens up on the screen.
Oh yeah.
Look at it. It's happening.
All right. Do we have liftoff?
We're loading. There it is. Well
We're
done.
good? Okay. Fantastic. Okay. So the title of our report is Investment in Early Education and Care in Massachusetts, Celebrating Successes Looking Ahead. And we're very grateful to have produced this report in partnership with our friends at the Boston Foundation. So let me begin with the focus of the report. So we find ourselves in an exciting moment for early education and care in Massachusetts. Investment overall is up, and we're seeing really positive impacts from that. So what we're really interested in now is this question here, which is essentially how can we use our recent successes in funding to transform what has historically been a very patchwork kind of funding model into something that's more coordinated, more cohesive. In a sense, in a way that will really sustain the sector long into the future. So to begin to answer this question, our report offers a landscape analysis that takes stock of how the funding landscape has changed in recent years, and then considers how we might move forward from here. So we really hope it will serve as a tool for alignment and for continued conversation toward collective action. Just a quick note on our methodology. Our research had three main components: a review of existing research, 24 interviews with stakeholders from across the sector, and five focus groups with a variety of types of providers. I will briefly touch upon taking stock. So this section of the report contains a lot of technical information about these funding sources that you see listed here, as well as funding streams in these three categories, including what has changed for each source and each stream since 2020. So we won't go into detail here, but just so you know kind of what is in the report there. There's essentially kind of a glossary of funding sources and funding streams for early ed and care. Here's just a little example, a snippet of a table in the report that breaks down C3. So there's a description, notable developments since 2020, and that same format is replicated for many streams. All right, I will turn it over to Ellie to talk through some high-level strengths and challenges with the investment landscape.
Awesome. Thanks, Brian. Yeah, so the report covers in a lot more nuance some of the strengths and challenges that the early childhood field still faces currently in Massachusetts. But we'll share a couple with you this morning and encourage you to kind of dive into the report a bit deeper. But first, we have tremendous growth in the political awareness of the importance of early childhood on economic growth and overall child development and well-being. There really is this newfound attention to pushing Massachusetts forward in terms of building on the state's competitiveness, which may spark an influx of resources and help mobilize partnerships and investments in the sector moving forward. So that's a real strength that we see. Second, we see a strong commitment to sustaining the level of recent investments in early childhood, specifically at the state government level, which shows promise for sustaining and continuing the level of investment in the sector. And third, we see an increase in cohesion within the sector with multiple new initiatives, 30 Call being one of them, that really aim to kind of bring and convene stakeholders together to build more community and coordination across this field. So there are many more strengths than this, but these are a couple we wanted to highlight today, and want to keep these in mind as we continue to talk about the challenges that the field faces and how do we move past those and forward with those, which we'll cover quickly. So first being that even with the recent financial investments, it still remains insufficient to cover the true cost of providing early education and care to our youngest in Massachusetts. We all know this here. I think affordability of programs remains a major challenge, specifically for families whose incomes are just above the threshold for eligibility for financial assistance. And just more dollars are needed to ensure providers can cover their costs while also keeping tuitions affordable. Second is attracting and retaining talent is difficult given current compensation levels. So this is a real kind of challenge of the sector that has been for a while and continues as we see through our report and research. And then third, while the mixed delivery system offers many strengths to the sector, it can also complicate finding broad-based solutions and may require high levels of creativity to find things that work for everyone. So current funding streams form this complicated patchwork that's difficult to navigate, especially for small providers and family childcare providers that may be kind of more difficult in accessing information and resources. So this is something we'll talk a little bit about in a second with our recommendations.
And Ellie, Don, and Danette added, and the cost of care continues to rise, especially on the attraction retention line.
Yes. Awesome, thanks.
Great. All right, let's chat a bit about future directions. So in the course of our research, there were really four fundamental questions about the future of funding for the sector that surfaced many times and that we really view as key to address collectively in order to move toward a more coordinated funding model. So these four questions are: first, where should funding come from to cover the true cost of early ed and care, especially taking into account fair compensation for staff, which we know is a challenge for many. Number two, how can the sector coordinate funding streams to create a unified funding system? So what's kind of the mechanism through which these various streams get coordinated? Third is how can the sector best leverage the mixed delivery system, really leaning into the strengths of having a variety of provider types. And four, how can the sector advance the early educator profession? So creating opportunities for career advancement and again, fair compensation for staff. So these fundamental questions and possible answers are discussed in detail in the report. We're going to dive a bit deeper into two of them today for time, and I will pass it back to Ellie to introduce our first one.
Awesome. So where should funding come from to cover the true cost of early education and care? This first fundamental question that we examine in the report, we talk about and examine a couple different considerations, such as to what extent should early education and care be treated as a public good? What is the role or should be the role of local, state, and federal funding to maximize investment? And how might we sustain growing commitment to funding early childhood? So here are a couple takeaways that we have that relate to this question and those kind of key considerations. So certainly more investment is needed, though it is equally important to focus on optimizing the sector's funding model. Second is that all types of funders can and should play a role, especially the government, and alignment of all of these efforts is going to be very important in optimizing that funding model. And then there's interest in a foundation budget for early education and care, but real uncertainty about kind of how that would work in practice, which will lead us to the recommendation we have under this question.
Yeah, so this brings us to our first recommendation, and I first want to emphasize that all of the recommendations in the report are really intended for the sector as a whole, and we really strongly believe that collective action and aligning efforts is really critical for the sector's continued advancement, and there's a role that everybody can play. So our first recommendation is to determine the feasibility of a foundation budget for early education and care. There's been a lot of work in recent years to determine the true cost of care per child, and a foundation budget formula would calculate for each provider or potentially each unit of providers the amount that's needed to cover the true cost for the children they serve. From this calculation, funding streams could then be designed to complement one another to ensure that that foundational cost is met. So essentially, a foundation budget formula could serve as the mechanism to coordinate funding streams. We see a foundation budget in use for our public school system. Of course, the early ed and care sector, it has a very different context, given that there are a range of business models that providers use. So the concept overall warrants closer study of its feasibility. A foundation budget could also lay the groundwork for a Student Opportunity Act equivalent for early ed and care, where the state could, for instance, commit to incrementally increase funding to bridge the gap between current funding and the true cost of care. So we suggest that the state's early ed and childcare task force could begin to study the feasibility of this concept, of course, with significant input from the field. Back to Ellen.
And our second one of the four that we cover in the report is how can the sector best leverage the mixed delivery system. I mentioned earlier that this offers many, many strengths to the field, specifically around meeting families' needs. But there are also challenges when thinking about this system in relation to a more, coordinated and unified funding. So a couple things that a couple key considerations that we take into account in the report about how to best leverage the system is what the role of public schools should be in early childhood spaces, how the sector might best support the most under-resourced domains of early education and care, specifically family child care providers and infant and toddler care. Couple takeaways for this question and those key considerations I mentioned is that progress has been made to increase the support of infant and toddler care, but as we all know, further support is certainly needed. And the second one is partnerships between community-based providers and school districts are important to expand access to preschool without destabilizing providers' business models. And we'll dive into one of the recommendations for this as well.
So our recommendation here is to invest more in preschool partnerships, since partnerships leverage the strengths of all providers to expand access to high quality early ed and care. One way to do this could be to offer matching dollars through CPPI. So this could incentivize local investment, while also promoting some of the effective partnership practices that are required by CPPI, such as conducting a local needs assessment. Of course, at the same time, it's important that CPPI continue to support communities that would otherwise struggle to invest local dollars in partnerships. All right, let me just run through our additional recommendations briefly here. Again, underscoring these are intended for the sector as a collective. So first we have ensure that early educator career pathways support opportunities for career advancement outside of higher education, such as apprenticeships and work-based learning programs. Second, create a centralized user-friendly online platform for providers to access information on and apply for available funding. In our conversations with providers, many of them noted challenges in learning about funding or navigating application processes. So there could be room there to kind of streamline. And lastly, expand funding to subsidize the cost of early ed and care for the children of early educators, which we know has been a very popular and effective tool, especially to help retain parents of young children within the workforce. All right, thank you. That is just a small taste of our research. We encourage you to take a look at the report. There's a lot more detail in there. This QR code will take you to it, or it's linked in the 9:30 call email. So thanks so much.
Great, Brian. Some thoughts in chat. Great data from Kim Davenport. Great data as always. Thank you for this body of research. There have been a number of recent reports that with topics that intersect with each other. I'm wondering if there are any plans to integrate and centralize where we are, where we need to go, thinking of this report and Dr. Lieberman or connecting the dots and other landscaping planning work.
Sounds like a great job for strategies for children. I do think it's a very important question. I'll confess, I don't think we've thought about it quite that way, but I appreciate being pushed. I'm getting way ahead of myself, so I want to acknowledge that to the crowd. But one thought is there are resources out there like EC 101 that Ellie played a key role in designing that are trying to bring an understanding of the field to one place, and having a specific section that is research and data focused to get these reports all in one place might also be a way forward.
And I think it is something that we are, Kim, it's a good observation, but just thinking about what they say, we also know the department now has data dashboards. We also know there's a report from Mass Taxpayers Foundation. Hopefully Victoria will be on in January to kind of go over that. I think we have the most data accessible that we've ever had. We also kind of have places like this to match kind of the policy to the people. So that's exciting to think about. We have somebody listening in California. So good morning indeed. And I see Danubia is on the call. So it's great to see you, Danubia. Amazing data. Thank you so much for sharing. For Kids Only has seen the firsthand benefit of the Career Pathway Support Apprenticeship Program. Great. Don Holly, the pandemic exploded an acute level of fragility in the EEC system. As we move up to today and forward, how would you assess the current fragility goes to the urgency for moving forward with these solutions? So can you talk a little bit of kind of like what you learned by putting on this report together about the fragility? And I'm sure folks here on the call can also share some observations.
Brian and Ellie, oh, Brian, go ahead.
Yeah, no, I was just gonna add a quick note. I mean, I think in a lot of our conversations with both stakeholders and providers, there was kind of there was the good and the bad. We heard from a lot of folks that there certainly was a lot of fragility during the pandemic, but really the overarching theme was how much the sector has rebounded since then, and that these increased investments specifically from the state have really gone so far in really shoring up the sector. And laying a foundation for continued growth and investment. And so, we're excited to see kind of this increased mobilization of so many partners, so many different types of stakeholders who are coming to the table and wanting to contribute resources and solutions. And yeah, certainly, that the pandemic really laid bare that there's really great need. And so while that's, a negative in some ways, it's really turning into a positive. And that was echoed throughout our research, which is encouraging to see.
Yeah, I was going to build on that. I think, and credits, I'm sure many people on this call, far beyond what we're doing at the Rennie Center, there's been a tremendous amount of investment and growth in early education and care over the last few years in Massachusetts. Is it enough? Of course not, but it's headed in the right direction. But I think that creates a strong foundation, which is in our recommendation around thinking about a foundation budget, to start shifting the conversation from, okay, what is absolutely necessary to have providers be able to stay open and service the kids who come through their doors, to what is the actual investment we want to make to ensure that all children are well cared for and have opportunities for life success. That we're really beginning to talk about investments as something that will fully educate and care for the full child, not just make use of resources we have available to try to invest in the system. And then if we have that as a sustainable conversation, we can start to address the fragility that exists in the system.
Linda Schumacher added, thank you for recognizing the possible yet unintentional detriments community-based child care when distributing quality preschool funds. Bernadette Davidson wonders, what's the possible impact of changes in the federal funding on state child care budgets? All right, Rennie Center, get out. Tell us what's going to happen.
I wish we had an answer for that. I mean, the real answer is we just don't know. And I know that there's a fair amount of understandable anxiety out there, given all of the conversations that are happening of what might take place with the federal government and decisions with the new administration. But a lot of stuff gets said. I'll leave it at that.
Right.
And it's just too early to tell what the investments will be moving forward.
And 9:30 call plug. Danielle Ewan will be here on Monday, December 16th to give us at least what is happening right now at the federal level as we're having the Biden administration leave as the Trump administration comes in. And we've also been talking at Strategies for Children. We are launching a updated and refreshed website early next year. And we are going to have advocacy headquarters. And the big intention of that is going to be accurate information. Because to Chad's point, we're hearing a lot of things. There's a lot of fear and anxiety. There's a lot of stuff out there, but what is actually happening? How does government actually work? Who makes the decisions? So we're really excited about that. Tom Weber adds, Rennie team, great work and thank you for the presentation. Danubia and TBF, thanks for your leadership in bringing this forward. I also added in the chat earlier the recap of the Boston Foundation event, which Tom moderated the panel discussion. Do you see any active policy vehicles for advancing any of your respective recommendations? Where should we bring the 9:30 call party? And then Brian Gold added, what's next? We love a party, guys. Just tell us where to go.
Yeah, this is in many ways, I think, the question, the big question, and maybe not one we have a super concrete answer to at the moment. But I think that we're encouraged by the work of the task force that the governor's task force is doing, and in the report we highlight that they could kind of pick up the foundation budget concept and study some feasibility there. So yeah, excited to see what the task force continues to do. A lot of great work and information gathering that they've been working on for the past several months. So that's one. But it seems like every month there's a new big policy coming out or something being announced in the early ed space. So yeah, there's a lot of action and yeah, I don't know, Chad, you may have thoughts on other kind of opportunities to intervene somewhere.
Well, I might take this in a slightly different direction. I think there's a great opportunity for the early childhood field to build from its strengths. There is large dissatisfaction with education across the entire continuum right now. That includes K-12, that includes higher education, frustration related to cost, frustration related to the experiences that families or students having in engaging with institutions. And so I'm really clear that's not to put the blame on practitioners who are working really hard and being asked to do far too much to navigate not just academic learning, but also the social and emotional well-being and health of students, engagement with family, direction for where life choices may go. And here's the thing. Early childhood education has always been really good at presenting a holistic approach to learning. Not only attending to children's cognitive development so they're ready for school and beyond, but thinking about how play gets introduced into a daily learning experience. Being mindful of the emotional well-being of a young child, differentiating what you're doing and treating every child as an individual and making adjustments suited to their context and their needs. I think building on that of like, we know how to do this and the rest of the educational system can learn from us actually would be a really impactful way to start saying that's why we need a foundation budget. That's why we need steady, sustainable funding that services all children. And that's why we don't just want a plan, which is the basic recommendation in our report, but actual action steps afterwards that might perhaps even introduce legislation to bring that funding forward.
Thanks for that. A lot of appreciation and yeses in chat. I'm going to go to a few more comments and then Brian Gold has a question. So Kim added that we were waiting on the task force direction. It is a missing piece. And Neri Garcia from our team put in 2 events that are happening tomorrow. The Early Childhood Agenda Winter Convening is happening. So we have, I think, close to 140 people registered. We do see the agenda as a place where some of these discussions certainly are happening. And maybe, we can think about what that means going forward. And then we also are doing an event alongside Neighborhood Villages and SEO Local 509 on December 17th around what happened in the budget and what does it mean to you. So less about the line items and more about the impact. So we're excited for that. Brian Gold, I'm gonna have 2 questions, one from Edna, one from Brian. Brian wonders, moving from sector rebound to advancing the profession, can you share a bit more about levers for a foundation budget to increase compensation? In some ways, combining a couple of the report's fundamental questions. And then Edna wonders, I'm curious about how family childcare providers who often work independently without staff can take steps to improve salary compensation and benefits for themselves. I would love to understand how this proposal might apply to their unique circumstances. So this is a report, but we are hoping that, and there are recommendations in the report. So kind of those 2 questions as we kind of wrap up. Big questions.
They are big questions, but very good questions. I think on the foundation budget side of things, increasing compensation, we had a lot of conversations with folks around having a salary scale and whether that should be something that is kind of required in order to receive certain buckets of funding, whether there should be incentives to abide by a salary scale, or whether it should just be something that's kind of put out there as benchmarks that providers can try their best to meet. So I think that's a question mark that does remain, and especially if we move toward a foundation budget that is coordinating streams, then that it gets a little messier there with, how is the salary scale playing into all these different streams that are kind of uniting in this kind of formula. So that's maybe less of an answer, more of just another question, but I think the salary scale piece of it is interesting.
Yeah, and to add to that, I mean, part of this answer is what the field has been struggling with all along, which is just its investment and funding. And, I think to feel like that could be possible, it's recognizing the investments and improvements that have been made over the last few years and the real recognition that early education and care is a core part of our education continuum and is seen as a worthwhile public investment. Saying investment as opposed to good because we want to honor the mixed provider system. The big lever Brian mentioned, the Student Opportunity Act for K-12, which brought $1.5 billion in the state, was just recognizing the cost of education has increased and how do we then bring more investments into the field. So that will always continue to be part of it. Excuse me, having said that, I do think there are both challenges and opportunities that can take incremental steps if you're still thinking about a big investment. One is coordinating across systems. We have approached this largely through early education and care, but early childhood is much bigger than just, say, pre-kindergarten. And I think there's lots of opportunities to achieve economies of scale and maximize resources by getting healthcare and early ed providers and public schools and housing authorities all to be working together more efficiently and sharing resources, even creating perhaps community hubs more effectively than sort of working independently, because a lot gets lost there. One of the big challenges, and Amy, I know our time, so I'm hoping, don't mean to leave us here, but we presented at the Boston Foundation, Representative Alice Peisch did bring up the issue of quality. and saying, if we're making these investments, what are the quality standards we have to ensure across different provider types that the money is being spent on in ways that will benefit children and families. And I do think if you're talking about more money, that's going to increasingly be a conversation that also needs to be answered. How do you demonstrate the effect, not in research that's happened a long time ago, but the active programs that are serving children are benefiting those who are attending them, and that money is worthwhile.
And Ellie brought us right back to EC 101. Thank you for that, Ellie. And I think since the days when Tom and Chad we were working at SFC, we have been talking about this idea of a foundation funding, which really is about predictability, about having a plan, about getting money where we need it to go. And so really appreciate that part of the recommendation that, and just, and as we've seen in chat, just a lot of appreciation for thinking bigger than just early ed and a silo. I do think could be a job for the early childhood agenda as we think about next steps, because that really is focused on this larger ecosystem. And just really want to thank Brian, Ellie, and Chad for joining us today and for the chat. Thank you everybody for it's always more engaging when folks leave time and we can have these discussions in a half hour. So thank you so much for joining us. And then tomorrow we're going to hear from folks at Holyoke Community College who are working on a grant around mentorship. So hopefully we'll see you back here. Brian, if you have a chance, or Ellie, just send me the slides. We'll post them in our follow-up and I will send you the chat. Have a
So
great day.
much.
Thank you so much for joining us today.
Thanks, everyone. Thanks, Amy.
Thanks,
Appreciate it.
Chad.
Thanks,
Bye.
Amy. Thanks, everybody.